So with Botox, one thing very importantly is in Kenya it's expensive. All right, 50 units usually costs around 20 to 25,000 shillings in terms of the drug itself, without actually someone administering that to you. You're looking at usually a minimum of 100 to 200 units, basically for something, let's say for example, palmoplantar hyperhidrosis. Think of it as the one with the least amount of surface area, your palms and your soles. You're looking at about 200 units. You're not going to get that treatment done with a professional who knows how to do it for less than 200, 300,000 shillings. All right? Because the idea behind it is not just the Botox itself, it's how it's administered and how the injections are done. It has to be done in a specific layer of the skin so that it targets the sweat gland. All right? Because most of the time everyone thinks injection is injection, whether you're doing it here, whether you're doing it here. Technique is a very important factor. You can get chips in town for 20 bob, you can get chips in town in Kempinski for 200 shillings. What's the difference? Quality. Quality is a very, very important factor which Kenyans especially don't think of when they're getting treatment. So they will always look for the cheapest solution. Now the problem with getting the cheapest solution is, yes, you will get the procedure done. Whether it works or it doesn't work is another factor. So with Botox, one thing very importantly, it works, yes, but it's a very, very expensive thing that you can actually manage to do, because unfortunately none of the insurance companies do give it as yet. Even though it is a medical condition, Botox is still considered as cosmetic in this country. So we still don't have insurance companies on board to treat hyperhidrosis with Botox. So it becomes quite expensive for patients. Now let's say for example, someone you get in town is injecting you for 150,000 shillings, let's say for example, and you think this is a bargain offer. You know, I mean, Daktari said 300, I'm getting it for half the price. Is it going to work? That's a very important question, okay? So it has to be done by the right person, in the right way, in the right units. Now, each injection, usually you'll be looking at between 3 units and easy 10 units, depending on the severity between mild and severe of hyperhidrosis. So imagine 10 units per injection. Your palm would be about maybe, for example, 70 to 100 injections. You're each looking at that much. Imagine the units you'd be using. Right? So always look at the right treatment at the right time for yourself. Don't just jump to conclusions and try and look for something that worked, for example, your friend. Everyone ties and tells us this, especially in Kenya, this is very common. It worked for my sister, it worked for my friend, it worked for my neighbor. Why hasn't it worked for me? You are different. It doesn't matter whether what you heard about. Everyone is differently made. The hyperhidrosis someone else would be suffering from might be bromhidrosis, which you had no idea about. So the diagnosis might have been different and he might have had better chances because for him it was actually something totally different. And for you, it's severe generalized hyperhidrosis, for example, of underlying thyroid condition, which you have no idea about. So it becomes that kind of problem.